So, if you've ever had a really bad case of acid reflux, chances are you've come across the name Pantoprazole. But have you ever wondered how that little pill actually does its job? Well, today, we're going to pull back the curtain and look at the super clever science that lets it flip the off switch on your stomach's acid production. Let's dive in.
You know that feeling, right? That burning, awful sensation that feels like a tiny volcano is erupting right in your chest. For some of us, it's just an occasional thing, but for millions of people, it's a constant, painful fight.
And, there's a world of difference between that occasional, oops, I ate too much pizza discomfort and a serious chronic condition like GERD. With GERD, that constant backwash of acid can actually cause some real damage to your esophagus. And that's when you need something a little more powerful to step in. To really get how the solution works, we first have to understand where the problem starts. So let's zoom way in. I mean way, way in, all the way down to the cellular level, inside your stomach lining.
So say hello to the main character of our story, the proton pump. The best way to think about these is as tiny little acid factories. They're all over these specialized cells in your stomach, and they have one job and one job only: to pump acid out. They are the absolute final step in making stomach acid. Okay, so if the proton pumps are the factories churning out all this acid, then pantoprazole is basically the master key that's designed to go in and shut the whole operation down. And this is where the design gets really, really smart. You see, when you swallow a pantoprazole pill, it's actually inactive. It's what's called a prodrug. It just cruises harmlessly through your bloodstream until it gets to those stomach cells. It's only in that super acidic area, right next to the proton pumps, that it suddenly activates. It's like a secret agent that only reveals its true mission when it's right on top of the target. And get this isn't just a temporary fix. The bond it creates is irreversible. Once pantoprazole latches onto a proton pump, that specific little factory is out of commission for good. It is permanently disabled. It's never making acid again. That irreversible bond is exactly why the drug works for so long. We're talking over 24 hours. Your body can't just unlock the pump. To start making acid from that spot again, it has to build a brand new proton pump from scratch, and that takes a while. And this just perfectly shows the huge difference in strategy here. An antacid like Tums is like a mop. It comes in and cleans up the acid that's already spilled, which gives you really fast but really temporary relief. Pantoprazole? It doesn't even bother with the acid that's already there. It goes straight to the source, the factories, and just shuts them down to stop more acid from being made. It's preventative. So now that we get how this powerful off switch works, let's take a look at the specific medical conditions it's actually designed to fix. Its number one job, for sure, is treating GERD. It gives the esophagus a much-needed break so it can heal from all that acid damage. But it's also used for even more serious stuff like erosive esophagitis and peptic ulcers. It can even handle the crazy amount of acid produced by a rare condition called Zollinger-Ellison syndrome. And it can act as a bodyguard for your stomach if you have to take drugs like ibuprofen for a long time. All right, but here's the deal. When you're using a tool this precise and powerful, you absolutely have to follow the instructions. And when it comes to pantoprazole, getting the timing right is everything. And this brings us to probably the single most common question people have about this medication. Why the super specific timing? Why do I have to take it so far before I even think about eating? The answer is actually pretty simple. The very act of eating, or heck, even just thinking about food, is the signal that tells your proton pumps, okay, time to wake up and get to work. Food is literally the on button for your acid factories. So you take the pill 30 to 60 minutes beforehand to give it enough time to get absorbed and travel through your system. That way, the activated drug is already there, lying in wait, ready to pounce on those proton pumps and shut them down the very second they switch on. You see, timing is crucial. Okay, next ironclad rule. This one is completely non-negotiable. It's written on every single bottle for a very, very good reason. Never, ever, ever crush, split, or chew the tablet. So here's why. The tablet has this special protective shield on it. It's called an enteric coating. Think of it like a tiny acid-proof raincoat. This shield protects the medicine from the super harsh acid in your stomach, allowing it to pass through safely and get absorbed in your intestine. If you crush the pill, you completely destroy that shield. The stomach acid will just obliterate the medicine before it ever gets a chance to work.
Okay, we've talked a lot about how effective it is, but with any powerful medication, we also have to have a serious talk about the risks. It's so important to understand the fine print.
Now, the most common side effects are usually on the milder side, things you might expect, like headache, maybe some diarrhea, nausea, or stomach pain. For most people, these are pretty manageable. However, the bigger conversation, the one that really matters, is about what happens when you use these drugs for a very long time. The evidence is pretty clear that staying on them for years can come with some more serious potential problems. Now, these aren't guaranteed to happen, of course, but the potential risks are definitely something to be aware of. We're talking about things like potential kidney problems, a higher risk of bone fractures, and issues absorbing important nutrients like vitamin B12s and magnesium. Plus, since stomach acid helps kill bad bacteria, lowering it can in some cases increase your risk for certain infections. These risks are serious enough that the FDA actually puts its strongest possible warning. It's called a boxed warning on the over-the-counter versions. It makes it crystal clear. These are for short-term use only, like 14 days. If your heartburn is so frequent that you need it longer than that, you absolutely need to be talking with your doctor. So at the end of the day, it's all about this balance. On one hand, you've got this incredibly potent drug that can heal serious damage and give amazing relief to millions of people. But on the other hand, you have to weigh the potential long-term risks and recognize that you need a doctor's guidance to use it safely. And that really brings us to the most important takeaway of all this. Pantoprazole is an incredible, powerful tool, but for most of us, it isn't meant to be a permanent solution. So the key question you should always be discussing with your doctor is this one. Am I using this for the shortest time necessary at the very lowest dose that actually works for me? Understanding how it works is the very first step to using it wisely.